Hi there, it's RK from Migraine Australia again. It's time to talk exercise and migraine as part of Migraine Awareness Month's Wellness Week. If I can get all of that out. And to help us do that, we've got Emily Cordes. Emily is training to be an exercise physiologist and is well known to some of you for her fantastic Insta and blog on exercising with migraine. Thank you for joining us, Emily.
Hi, thanks for having me. Nice to be here.
Again, we do like having you back. We're a bit of a fan. So let's just start with the beginning of what is an exercise physiologist and what they do.
Yeah, great question. Exercise physiology used to just be an academic field which investigated the effects of exercise on the human body. However, here in Australia, we have created an allied health profession from this. So nowadays, exercise physiologists in Australia are allied health professionals who can prescribe exercise for people living with chronic illness and injury. So
Okay.
it's management and prevention of chronic illness.
So how does that differ from, say, a physio?
So physio would be more likely to help you out in an acute stage of an illness or an injury. So you might see them if you're in hospital and they're getting you up and moving and breathing properly after a surgery, for example. Or obviously if you injure yourself, like you get a knee problem or a shoulder problem, we're all familiar with that, we'd go and see the physio. If that ends up transforming into something that you're living with on a longer term basis, then that's when your care would shift from a physio towards an exercise physiologist. So we're more focused on chronic conditions, things that you're going to have for a longer period of time or you have had for a longer period of time. And we're trained in anatomy, physiology, and pathology. And then on top of that, how exercise interventions can modify those things, I suppose.
Okay. So how is exercise beneficial for migraine?
Well, I think there are a couple of different things here, right? So exercise is beneficial for migraine because it's beneficial for all of us. It can help us improve our cardiovascular health, our mood. It can help us sleep better. It can help us avoid a whole host of other chronic conditions, lower our risk of cancer, all of these things. So I think it's important to remember that we're still human beings with a body that kind of needs taken care of, I suppose, and exercise is great for us in lots of ways. And then actually you can get migraine specific. And in the past decade in particular, there's been a fair amount of research into exercise, particularly aerobic exercise, for migraine treatment as a sort of prophylactic treatment. So we know that there is at the moment moderate evidence to suggest that regular aerobic exercise can actually reduce the frequency and intensity of migraine attacks and overall improve the quality of life as well. So that's really exciting.
It is kind of exciting to find out there's something we can do. We don't need a doctor, we don't need a drug, but we can do this one thing. What does aerobic exercise mean?
So aerobic exercise is exercise that moves, that has the whole body moving, all the large muscles of the body moving, and then they require more oxygen to keep moving. So to get more oxygen, we need to breathe more quickly and the heart pumps faster. So it's that mode of exercise where you're getting the whole system going. You're going out for a walk or a run or a swim, cycling, dancing, Zumba, whatever it is. That's usually kind of compared and contrasted to strength or resistance training, where we're more focused on slower, more static style movements that are just improving particular muscular strength.
Okay, so the treadmill, not so much the weights.
Yeah.
Okay. So lots of people with migraine, like myself, struggle with weight. And I know there's some studies around, reducing weight can also help prevent migraine, but really trying to get moving when, exercise may trigger your migraine or it may make your migraine worse is really quite difficult. What can you tell us about how is the best way to go forward with planning an exercise routine or whatever you want to call it when you're dealing with this condition that tells you to go to bed?
Totally understand. Exercise is absolutely a trigger for many of us. And I'm actually doing some research for a project for my final thesis at the moment at uni, looking at barriers to exercise for people with migraine, which is really interesting and exciting. And I think at least 40% of us report exercise as a trigger. I personally find it a trigger. So I've had to do this for myself as well over the last few years as my migraines become chronic. I think that it's also important to remember that sometimes it's not actually just the exercise that's triggering, it's the environment as well. So there are things we can do if we want to exercise where we can consider maybe not going out in the bright sun or the heat, or a gym where there are fluorescent lights. You know, maybe you'll be better off doing something at home or in a smaller studio, Pilates studio, or a walk in the evening. In terms of starting to establish a routine, I would say there are a few key things. And the first is to really start with thinking about why you want to do this for yourself. What does this mean for you? If you could get yourself moving and start exercising more, how would that make you feel? Because I think if you can come at it from that point of like, I want to do this because it makes me feel good. I'm looking for a way to nourish myself and nurture myself, rather than I need to make my body do this because either I have to lose weight or I have to do something to help my migraines. Those things are there and they can come, but we're less likely to motivate ourselves if we start from that. So start from that point of like finding things that you enjoy, things that you want to do. Then we'll go into migraine management mode, which is let's start slowly. Let's start with a smaller amount of time, so shorter session. Make sure you warm up and build really gradually over time. So if you want to get to a point where you're going for a lovely 30 to 45-minute walk 3 or 4 times a week, let's not start with that. Let's start with doing a 10-minute walk 3 times a week. And then after a couple of weeks, let's do a 15-minute walk 3 times a week. Over the long term, even if it takes you 6 months to reach your goal, then you have that there and you've got that baseline. So I would say increasing gradually. Warming up is very important. Staying hydrated, keeping your blood sugar stable. So making sure you've eaten within the last couple of hours before you go out, and eat as soon as you get back as well. Contrary to some sort of fitness advice out there, that's important for us. And then, managing your other triggers and not giving yourself a hard time when you can't do it because of migraine. Because honestly, when you're in an attack, we know it's one of the sort of classification, like the symptoms that makes you classify with migraine is that movement can make the head pain worse. So it's totally understandable. That was a long-winded answer, but there we go.
No, it's really valuable. There's a bunch of things in there I just wanted to kind of pull out. So the bit about keeping blood sugar steady, or making sure that it doesn't drop too much, because for a lot of us, failing to eat regularly, like keeping that routine so that you keep your blood sugar steady, can actually be a fairly significant factor. Yeah. Are there types of exercise that are more stable, as in you're not burning blood sugar as quickly? So something like your calming kind of exercises like swimming or yoga, are they better than high impact stuff?
Yeah, so there are a couple of things here. So first, I would say that yes, if you stick to the low and moderate intensity aerobic exercise, it's going to be easier to manage. And also because it means, this is just a really silly sort of practical thing, right? You could probably eat half an hour before a walk. But if you eat half an hour before you go and do high intensity exercise or a massive strength session at the gym, that can make a lot of people feel really nauseous. And so from a practical point of view, you don't tend to want to eat that close. So it's easier to keep that steady if you've eaten between half an hour and an hour before you go out. And yes, I would say low to moderate intensity would be best. But the other interesting thing is that I think a lot of us avoid high intensity because we find it's a trigger. And for many of us it is, me included. But I will just say that for a lot of people it isn't. And actually there is some evidence saying that high intensity exercise can be really good for people with migraine. So it's one of those tricky things where you have to kind of do your own individual experimentation. Once you've got a good baseline, once you feel like you're able to get out and go for a 20-30 minute walk, you could play with adding a jog, or if you wanted to, you don't have to.
Just keep exercising is kind of more the point. Yeah.
Find what you enjoy, I think,
Yeah.
is really key.
Absolutely. All right. So say, for example, somebody wanted the help of an exercise physiologist to figure out their plan. How does that work? Do you get referred by a GP or do you just make an appointment?
You can do either. So in Australia, you can make an appointment and go and see an EP, and some health funds will cover you, private health funds. So you can certainly ask them about that up front. Then there is obviously also the chronic illness management plans. I'm getting the wording of that wrong now that
I know what you mean. It's the chronic health management plans, I think they're called.
Yes.
That's where the GP can refer you for a number of sessions with an allied health professional, and it's
5 sessions with an allied health professional. So you'll need to talk to your GP about that. And I would say not everybody with migraine who suffers from migraine will be eligible, and not all GPs will necessarily agree that the same person with migraine would be eligible, because it is at the GP's discretion to decide whether you require or would benefit from a healthcare plan like that. But if you can get onto one of those, then you can have 5 sessions with any allied health professional. So they might suggest, for example, with migraine, that you see an EP, like accredited exercise physiologist, for maybe 2 sessions, and maybe a dietitian or a physio if you've got neck issues, or a psychologist. So there's not psychologist, dietitian.
Psychologists got their own plan. Yep.
Yeah, exactly. But yeah, so they can mix it up. So you wouldn't necessarily do all 5 with an EP, but you can.
All righty. Thank you so much for all that information, Emily.
No worries. Thanks for having me.
I think we've got more coming from you through Migraine Awareness Month. We thank you so much for your support.
Wonderful. Thanks.